So, what is an implant? An implant is a procedure that we do to try to fix missing spaces in our mouth. Whenever we have a missing space in our mouth, the tendency is that the tooth below it that wanted to touch that tooth starts to drift towards the space. The two teeth next to the space start drifting towards the space as well. So what ends up happening is a lot of your teeth start to get unaligned in a way, and you can develop spaces inside your mouth. You can develop things like periodontal disease because as teeth drift upwards, sometimes the bone doesn't get pulled with it, and sometimes you create a situation where you get extra bacteria underneath certain teeth there. And so one good solution is an implant. An implant is basically a metal rod that acts like the root of the tooth that gets placed inside the mouth so that it can mimic the tooth root so that you can place a crown on top. So this is an example of an implant. You can see that there's a metal piece that goes in. It takes 4 months for the implant to osseointegrate into the bone. So after it's placed, it takes 4 months. And then typically you place an implant crown on top of it when you are done. Very good option because you have a one tooth problem, one space problem, one tooth solution. This contrasts the decision between implant and bridge, for example. So a bridge, what is a bridge? A bridge is a procedure that cuts the adjacent teeth in order to fill in the space. So if you have a space in this area here, similar to a crown, you cut 360 around the teeth, on the two teeth next to the space, so that it can receive a bridge. The problem with the bridge is that you can't floss it directly. You have to take a special floss threader, go underneath the bridge, and floss each side of the teeth that are next to the space. Which is why the implant typically is the best option long term, because if you have one tooth there, you only have to floss like normal. It feels like normal. And also implants don't get cavities underneath them. While bridges, you can get cavities underneath the bridge, and if you get a cavity underneath the bridge, you're redoing the bridge. And so you can have like a double cost to you long term, with all things being the same compared to the implant. Thank you for watching the video. Again, knowledge is power. A lot of times, sometimes a little bit of extra information gives us the motivation and knowledge to be able to change our own behaviors. And so I hope you found this video helpful to you. Here at Atlanta Dental Team, what we really care about is our patients and our family. And so we really want you to gain all the knowledge you can so that you can make the best decisions and save the most money, obviously. Keep your mouth healthy and have a blessed day.